Should you get your hemorrhoids removed? AKA a hemorrhoidectomy is the question. And this lady is young, 25, never been pregnant. So we've a lot to consider. Hemorrhoids are basically swollen blood vessels on your anus, so your bum hole. Sometimes they're on the outside, sometimes they're on the inside, so they're easier to see when they're on the outside. And they're basically caused from pelvic congestion, so swelling of the blood vessels. Most commonly occur during pregnancy, after you've had a baby. They can occur just from chronic constipation or even as we age later on in life with hormonal changes. So Sherry Proct comes in creams or suppositories, which helps to shrink the blood vessels, okay? But what you can be left with is a skin tag. So after the blood vessel shrinks, you can still get a little skin flap hanging out. Some women kind of want to get rid of this because they don't like the look of it. If they are actually still swollen and painful, we've got to treat that. And if they're really big and really swollen and you can't sit down, if it's been going on for weeks and weeks or months and months and conservative treatment isn't working, I don't blame women for wanting to get them removed. But if it's just a skin tag, you really should reconsider. The best treatment for hemorrhoids is actually looking after your bowels, getting your poos out easy with all the things we always recommend: water, fibre, fruit, laxatives. Get the poos getting out easier so you're not straining, sitting on the toilet too long, sitting on your phone for ages and putting pressure down there. Even lifting heavy weights for people like deep squats can put pressure down there. And we want to be able to relax our muscles. So if it's painful, we tend to tense our muscles and then it's harder for the poo to get out. And then that makes the hemorrhoids worse again. When it comes to treatment, there is new things like laser and radio frequency coming out, and they can just kind of burst or lance the hemorrhoid itself. But when it comes to hemorrhoidectomy, actually removal of the hemorrhoid, we've things to consider, especially your age profile. So if you're had your first baby, or like this lady hasn't even had a baby, there's a good chance you'll still get hemorrhoids again. When they remove them, we've got to consider how really delicate the tissue is around our back passage. It isn't just normal skin. So when you do a surgery there, you're going to cause scar tissue, and that can cause weakening of the tissue or the muscles. And as we age, this part of our body gets weak anyway. So women and men can experience episodes of fecal incontinence or like poo accidents. And if we've already had a surgery in the area, that weakens the area more. So is it really worth it if conservative treatment could help? And especially if it's just a loose skin tag that you just don't like the look of, it's really not worth doing anything then. Commonly, hemorrhoids are actually a symptom of an issue, be it constipation, be it hormones, be it blood vessels, be it congestion in the pelvis. They're a symptom rather than the problem itself. So treating the hemorrhoid doesn't always mean that the problem's not going to come back. So like everything, we would treat the problem, not just look for the simple solution. I know they're a pain in the bum, literally.